So thank you very much. I guess we're all getting our exercise in for this morning, walking across the room. So I'll just give you all time to get seated. Can I have my slides? Okay, thank you so much. So we'll be going through some clinical scenarios today, and I'm quite old-fashioned, so you'll find that you'll have handouts and colored paper. So this session will be about adapting, how we can adapt our clinical consultations. So for the first part of this talk, I'm just going to bring you through what the clinical frailty scale is, and then we will be going through some clinical scenarios to learn how to score the clinical frailty scale. And so hopefully each of you would have had some 3 colored cards, and if you do not have a handout, you can also scan that QR code. And just a note that 2 of the QR codes don't work on the handout, but the one in the middle does, all right? And then we will end the session with some discussion. So to just kind of get us warmed up and get us started, I just want to ask you guys this question. So after learning about frailty, you know, from the last few days and also hearing Dr. Grace just now, how do you feel about assessing frailty in people living with HIV? Do you feel like you can do it? So that would be a green. Do you feel maybe you can do it? So there is hope. Or do you think, no, not for me, thank you, and I give up? So I'm just going to give you 10 seconds or so to kind of vote. Oh, that's really quick. Ah, we've got some greens. Thank you. Okay, yay for some greens, but I think mostly yellow, so that's very encouraging. I don't see any reds yet, okay? So that's great. And we all got the hang of voting already, okay? So this is the clinical frailty scale. It's actually a scale that was created by a geriatrician called Kenneth Rockwood back in 2005, and then he revised it in 2007, and again, the latest one was revised in 2020. So as you can see, it's a scale that starts from 1 down to 9, with 1 being very fit and 9 being terminally ill. All right? And so I'll just take you through the scale. So for a score of 1 to 3, basically someone's symptoms do not limit their activity. So for 1 to be very fit, it would be an individual that exercises regularly, and they would say they're among the fittest of their age. So I think as we go through this, we can probably try to score ourselves as well. So some of us maybe will fall into the very fit. Maybe some of us would have gone for a run this morning before we've come here. And then you've got 2, which is fit. And these people have active disease, but it's well controlled, and they exercise occasionally or seasonally. And number 3 would be someone who's managing well. So they walk and they're fine, but they don't exercise at all. So this is the scale from 1 to 3, and I'm probably like between a 2 and a 3. So I don't know about the rest of you. Okay? So that's scale from 1 to 3. And the next part is really a scale from 4 to 7. And at this point, this is when we start to pick up, oh, maybe they're starting to have a bit of frailty. Okay? And their symptoms start to limit their activity. So if you're a 4, you're living with very mild frailty. And in the past, this used to be labeled as vulnerable. So this would have been considered your pre-frail. But now they've called it frailty. All right? And then it just progresses and gets more severe to 7. And for 8 and 9, these patients are normally towards the end of life. Okay, so they're living with very severe frailty or they're terminally ill. For the purpose of this session, I'm not going to focus on the 8 and 9 because I think most of us are able to detect someone who's towards the end of life. And most of us will have a challenge figuring out between the scale of 1 to 7, where does this person lie? So I'm going to start off with the first case scenario. It's a video. All right. And over here, we've got Mr. Andrew Tan. Some of you will know him. And also Dr. Kajal, our friendly geriatrician who has agreed to help us out this morning. So I'm going to play this video. And what I would like you guys to think about when you're watching this video is, what do you think the frailty score is? So you can refer to the handout that you have, but also try to listen to the video and see if you can score it. Okay?
Hi, Mr. Andrew Tan. Good morning.
Good morning.
How are you?
Okay,
Okay. And from the last time we met you till now, how have you been?
fine.
Good to know. Shall we just move on and check your viral load?
Yes.
So your last viral load has been well suppressed, and you're taking your medications well?
Yes, I am.
Okay.
All right. So that is the first video. And so your first question, you'll have about 20 seconds to think about it, would be, do you think he's 1, very fit, 2, fit, or do you think we have no idea how frail he is from that consultation? So I'm just going to start the timer, and when you're ready, you can put it out. It's okay. It's fine. Don't worry. So I see a mixture of some reds and yellows and some greens, all right? But mostly it's red, all right? So, oh, there's a sound to the timer. All right, just to give you some adrenaline. So the answer actually is no idea. And the reason why I put up this scenario is because this, I think, is representative of majority of our clinical consultations. Most of the time we just go, hi, how are you? You're fine, that's great. Let's move on to your medications. You're taking it ace, you know, you're good to go. And so we can't really figure out whether they're frail at this point based on that consultation. Okay, so this would be a slightly different scenario. So again, what we'll do is we'll watch this video and try to decide how frail do you think he is.
Hi, Mr. Andrew Tan. Good morning.
Good morning.
How are you?
Oh, okay.
Good. For the last 6 months, we last saw you in last August. How have you been?
Fine.
Okay, good. So can I just ask you a little more? Do you exercise?
Oh, yes. Yes, I do.
Ah, great. Can you tell me a little more? What do you exercise?
Usually it's walks
Okay.
around the park.
Mm-hmm.
And if I've got a bit of more energy, then I'll do a bit of running, intermittent, and then swimming in the condo swimming pool.
Oh, wow. That's nice.
Okay, so hopefully everyone could hear that video. All right. And again, what is the frailty score? And we'll have a timer. Most of you seem to have made up your minds already. I was arguing with Rena about whether you needed 10 seconds or 20 seconds, and everyone's like, okay. So mostly yellows with some greens and maybe a couple of reds. All right. So you think very fit or managing well. So for this person, we would actually say he's very fit, okay? Because he does exercise really regularly. I mean, he does swimming, he does walking, and all sorts of things. So I would actually put him at a very fit. And so how do we ask about frailty, or how do we start to ask about frailty? And I hope to convince you that by asking 3 simple things, you're really going to be able to differentiate where he falls on the scale. So the first question, which is relatively easy, is just to ask, do you exercise? And if they do exercise, what type of exercises do they do? And how frequently do they exercise? And simply by just asking them about whether they exercise, we're able to figure out where he falls on the scale between 1 and 4. So if you ask him whether he exercises, and he exercises regularly, he goes to very fit, which is 1. If he only exercises occasionally or sometimes, he's a 2. And if he never exercises beyond regular walking, he's a 3. But once he starts to feel any type of slowing down of his activity, he goes into mild frailty. All right? And just a note, in case any of you are trying to figure out the scale based on the pictures do nothing. So I don't even know why they have the pictures in the clinical frailty scale, but it actually has no correlation whatsoever with the score, okay? All right, so by asking, do you exercise, you're able to discern between the first four. Okay? So the next scenario, it's a little bit longer.
Hi, Mr. Andrew Tan. Good morning.
Good morning.
How are you?
Oh, okay.
Good. For the last 6 months, we last saw you in last August. How have you been?
Fine.
Okay, good. So can I just ask you a little more? Do you exercise?
Oh, yes. Yes, I do.
Ah, great. Can you tell me a little more? What do you exercise?
Usually it's walks
Okay.
around the park.
Mm-hmm.
And if I've got a bit of more energy, then I'll do a bit of running, intermittent, and then swimming in the condo swimming pool.
Oh, wow. That's nice. And you're still swimming and jogging up to maybe yesterday?
No. Actually, I stopped about 3 weeks ago.
Can you tell me a bit more? Why did you stop?
I didn't feel like I had the energy, to continue. I was getting tired very easily.
Okay. It was just tired. You had no particular, for example, chest pain, dizziness.
Oh yeah. Before that, I was feeling a bit dizzy. And I think it was about that time I slipped. I had a fall.
Oh dear, okay.
But I think the bathroom floor was wet. So yeah.
Okay. So 3 weeks ago, you slipped and fell in the bathroom. And since then, you have not really gotten back to your regular jogging and swimming.
Yeah.
Okay.
I don't feel quite as stable.
I see.
Okay. But I try to walk.
Okay, so a little bit of a longer video. So let's see, what do we think the frailty score is for this video? You have 20 seconds, but feel free to put your answers up earlier. Rina! Okay, all right. So mostly reds, I think, but a couple of yellows, okay? So I'll kind of explain the answer after this. So he's being put at very mild frailty, all right? And if we kind of read the definition for very mild frailty, it says, while not dependent on others for daily help, often symptoms limit activity. And he did say, he's slowing down a little bit and not doing as much as he used to do. So this starts to put him at the very mild frailty, or previously what was known as vulnerable. And so the second thing that we can ask, apart from exercise, is whether they're still exercising in the last 2 weeks, because the clinical frailty scale really looks at the previous 2 weeks. And we want to ask, if they don't exercise anymore, what stops them from exercising? And when you ask about what stops them from exercising, if it's their symptoms, we're starting to look at a 4, so very mild frailty. And if you ask them a little bit more, oh, you stopped exercising, these are your reasons, do you need any help with anything? And if they do, with high order instrumental activities of daily living, like finances, transportations, or heavier housework, although I know that housework bit is subjective, then they go into very mild frailty. And you can also ask them, you need help, but do you still go out? So whether they still go outdoors. And so just by asking these simple questions, you're actually able to find out whether they are at very mild frailty or going into mild frailty, okay? So someone that stops going out and is so always mainly staying indoors, they go to a 5, which is mild frailty. Okay, so I hope you're all still following me with that. And I've convinced you that it's very mild frailty. So this is our last case scenario, case scenario 4. Just going to play the video.
From the last 4 that you had till now, have you noticed anything else that has changed along the way?
No, not really. But today I had to ask my friend to drive me here because I wasn't quite sure about my ability, because after the fall I don't seem to be able to coordinate quite that well.
Okay. So now driving, you're already needing someone to be with you.
I feel it's safer, yeah,
Okay.
because the thing is that sometimes I get worried when I want to press on the brakes and the leg doesn't respond.
Okay, all right. I'll definitely come back to this, basically to reassess the safety of you driving. But apart from driving, if you want to go out to get some things and all that, are you still getting your friend to bring you along?
Yeah, it's easier that way. It's kind of like, I have company and he helps me with the groceries, as well. Yeah. So whenever they are free, I'll get someone to accompany me.
Okay, and this help has only come about in the last week or so?
I've only asked for help about
Just recently?
Yeah, just recently.
Okay, so Mr. Andrew, just for me to understand, 3 weeks ago, everything was good. You used to exercise regularly. 3 weeks ago, you had a slip, you fell, and then you feel a bit unsteady. So you are no longer doing your regular exercises, no longer doing much of the activities outside the house. But when you have to, in the last 1 week, you're already needing some help. Like today, your friend brought you here.
Yes.
I see.
Yeah.
But in terms of managing your own personal care, like shower, dressing at home, everything is on your own?
Oh yes, everything is fine there.
Okay, good. So you don't need much help in the house. It's mainly outside.
Yes, because I try to stay in as much as possible, because every time I go out, I have to disturb somebody to accompany me. So I don't need to disturb them so much.
I see. Okay, so we have got to investigate how you fell, why you fell, and also come back to your medication list.
Okay, so this is the next question. What is the frailty score? Okay, so do you think he's at a 4, very mild frailty, 5, mild frailty, and 6, moderate frailty? My goodness, look, you guys are pros already. Okay, but I'm still going to let the timer run in case anyone needs some extra time. Okay, so 10 seconds. I see mostly yellows and some reds, so no greens. Okay, so that's good. Okay, so the answer, as most of you have highlighted, is mild frailty. All right, so for someone to be in mild frailty, they need to start having some help. All right, and he mentioned that he needs some help with transportation, and he doesn't really go out unless he has that help. So the third thing that you need to ask to ascertain how frail he is, do you require help both indoors and outdoors? How often do you need help, and what kind of help specifically do you need? So do you need help with your bathing, your dressing, your self-care? Because if you do need help for that, you go into a 6 at moderate frailty. Okay, and we'll just go back to our little chart where you're asked, do you exercise? And no, he does not exercise. Do you go outdoors? No, he doesn't really go outdoors. But does he require any help at home? And he doesn't require any help at home, but he does if he goes outside. So he falls at a 5 of mild frailty. Okay, so these are the things that we can think about when we're trying to assess for frailty in a patient. Okay, and just to summarize everything, First and foremost, the reason why we chose to use the clinical frailty scale this morning is because it doesn't require any additional instruments. You don't require a tape measure to measure how far your patient needs to walk. You don't require a fancy gadget like a dynamometer that needs calibration, right? The real thing that you need right now is just yourselves. And I think for those clinicians in the room, we're all trained that, 70–80% of a diagnosis comes from your history. And as you can see, the skills that you need here are basically asking 3 questions. And these questions are quite human questions as well. Like you would ask, your friends, how are you? Have you been exercising? Are you well? You're not exercising? What's happened? Do you need any help? Are you going outdoors? Are you now mostly staying indoors? So these are very soft skills, very basic skills that we can all have. And we just need to hone in on them. Okay, so really just 3 questions to ask to determine if someone who's frail. And I know it's taken us about, roughly 20 minutes to go through these different scenarios, but actually the total length of the video put together was 5 minutes. Okay, so it doesn't take as much time as you think it does. Okay, so I hope that we've also illustrated through these videos that what we ask determines what we get. So if we just ask, hi, how are you? I'm fine, great. We're not going to get anywhere. If we only ask, do you exercise? We'll just say he's probably, very fit or fit, right? But the more we ask, the more we find out about our patients and how they're doing, okay? So the clinical frailty scale aims to ask about how a person moves, functions, thought and felt about their health in the last 2 weeks. And the next question that everyone always asks after screening is, what do we do after we screen, right? We were discussing this together before preparing for this session. And really, I think when you listen to the consultation, he brought up a lot of issues. Just by asking those questions, you find out he's dizzy, he had a fall, he's lost confidence in driving, he requires help to go out. And actually, those are the things that we can address, right? Whenever someone's dizzy, we have to address why they're dizzy, sort that out, and we can actually improve his frailty. So even though he's a 5, we can actually move him back up to even a 1, so long as we address these things. And if he's had a fall, does he have any injuries that's preventing him from getting back to his normal self? And if he does need any help, we can always refer to a physiotherapist to help strengthen his muscles again. And if he's lost confidence in driving, some occupational therapists do driving assessments. So that might help reinstill his confidence and improve his frailty. As Dr. Grace has mentioned, frailty is very dynamic. Okay, so in terms of what resources are available for management, so in general practice, they've also done like a meta-analysis in primary care looking at interventions that they can do to improve frailty, or at least physical frailty. And really the summary of it is it's mostly just exercises, whether it's strengthening or resistance exercises, and also kind of looking at their nutrition. And that's actually something that's really, really basic. Okay. So these are the resources, other resources. So there's actually an app called the Clinical Frailty Skill app that you can download and just answer yes or no on the app for a simpler way. And also a web page that gives you a similar tool, okay? So after learning about frailty, how do you feel about assessing frailty in people living with HIV? Green. Okay, no reds. All right, yay! We've achieved our objective. Okay, so thank you very much for participating in this session. I hope you found it helpful, and I hope these are things that you can take back with you. Then these are my acknowledgement slides. Wouldn't have been possible without all of these people here. And Mr. Andrew wants an Oscar. So, is it an Oscar? Yeah, for his performance, and I think he does deserve one. And we will move on to the discussion. Okay, so for this part, I'd just like to invite Dr. Jennifer and also Dr. Rina to the stage for this second part. But while they're coming up to the stage for this bit, we've also come up with like a feedback form for those of you that may be interested in like kind of learning more about how to practice holistic care for the older persons living with HIV. So if you can fill in this form, this would be really helpful so that we can kind of build capacity and knowledge on how to manage patients within our region.